Welcome to Woodlands Cannabis Clinic. I'm Dr. Casper, and this is a discussion about pain and pain syndromes. And I look at pain like I look at cancer. You know, cancer, everybody realizes, will kill and destroy a person. And that's mentally, spiritually, physically, and socially. If it doesn't kill them, it destroys them. And pain is the same. It will kill and destroy a person. With cancer, we fight cancer very fiercely. In the medical community, we will cut you, burn you, give you poison, have the church pray for you, do vitamins, do supplements, and cannabis treatment, and we'll use all that to fight cancer. But we don't have to give you poison to fight pain syndromes. So how does cannabis work fighting pain syndromes? As you've learned in the videos, you know how the nerves talk to one another with a very fast messaging system, and that we're using cannabinoids to land on the nerves to calm them down. So cannabis fights pain directly. It also fights pain indirectly. And with our experience, patients with pain, indirectly, they have other symptoms, almost like someone with PTSD phenomena has other symptoms. They don't sleep well, they have anxiety, their mind can race, they can have panic attacks, they're irritable, just like stepping on a dog's tail. And they can be aggressive, throwing things, yelling at things, punching a wall, ripping a door off a cabinet, for example. They also tend to socially isolate and socially avoid, hey, I love y'all, but I just don't feel like hanging out with you. I'm in pain, I don't feel like talking, and I'd rather go over here. I don't want to think about being in a car for 3 hours to come see you. So then they just isolate more and more and more, stop going to church, stop being around others, which leads to depression. So they feel bummed out about everything that they're going through. And so I'm going to have to live my life like this forever. And that's very hard for them. And then they turn to substances to try to numb themselves, to stop the pain. That could be nighttime sleepy anxiety, pain medications, and alcohol frequently. So these patients with pain, it's a very similar thing that happens to them that happens in PTSD phenomena. So the amygdala in your brain is the area of fight or flight response, and it's quick, very fast. And so if you have your hand in the fire, you move it really quickly. That took no thought whatsoever. That's your amygdala protecting you with fight or flight response from the fire. Well, a person with pain, their hand's in the fire and they move it, and then there's nowhere to go and they move again, and there's still more pain and they move again. They've got nowhere to go. They're caught in no man's land. So cannabis fights the symptoms that surround pain that I described: the sleep disruption, anxiety, panic attacks, irritability, aggression, social isolation, social avoiding, and depression and substance use. And the persons that are using substances for pain is, for pain medications or anxiety medicines or sleep medicines, it's up here. And when we introduce cannabis, it tends to create a like teeter-totter effect where when you get the right dose of cannabis in our program, the necessity for these other medicines decrease. Pain medicines, anxiety medicines, antipsychotics, sleep medicines, and even nausea medicine and alcohol. So this is a natural phenomena. And so we have our patients wean off their other medicine if they're eligible, as long as they don't regress and they do it in conjunction with their prescribing doctor. But we need the first primarily to have the right dose of cannabis. So cannabis treats the surrounding symptoms of pain, but it also treats the pain phenomena because it calms the nerves down, have the nerves communicate better with their neurotransmitter modulation. Plus it decreases inflammation. So most of our patients will say, hey doc, I feel like my pain is more distant from me even though I still have it. Pain is a response for the body, and we have pain for a reason. But they feel like, doc, it's more distant, it's not my face. Hey doc, I feel like I can move around a little better. I've got a little bit more motion in my lotion. I can put my socks on a little faster in the morning, or maybe reach for something, then I didn't have to think about it as much. And hey doc, I also noticed that I'm having some pain-free intervals where I didn't have those before, where I had pain constantly and pervasively. So they may notice if they're sitting in a chair, they have to squirm around because of their back pain, but then they may notice, hey, for a minute there, I didn't even think about it. I didn't even have any. And these intervals may be brief and they may be longer. They may be even days. And so what's interesting is the longer the person does the pivotal dose of cannabis that we teach, the more it impacts pain solidly going forward. The symptoms that surround the pain are treated very quickly, and now that gives less obstacles for them to be able to deal with their pain. So I hope this helps describe to you a little bit of how pain is important to us, that we want to help the person have a better level of wellness, health, including their mental, spiritual, physical, and social health. Thank you.